Epithelial tumors. Number 1. Seborrheic keratosis. Benign squamous proliferation. Common tumor in the elderly. Presents as raised discolored plaques on the extremities or face. Often has a coin-like waxy stuck-on appearance. Characterized by keratin pseudocyst on histology. Laser trailer sign is the sudden onset of multiple seborrheic keratosis, suggest underlying carcinoma. Acanthosis nigricans. Epidermal hyperplasia with darkening of the skin. Velvet-like skin. Often involves the axilla or groin. Associated with insulin resistance, for example, non-insulin dependent diabetes or malignancy, especially gastric carcinoma. As you can see in figure 19.9, acanthosis nigricans. Number 3. Basal cell carcinoma. Malignant proliferation of the basal cells of the epidermis. Most common cutaneous malignancy. Risk factors stem from UVB-induced DNA damage and include prolonged exposure to sunlight, albinism, and xeroderma pigmentosum. Presents as an elevated nodule with a central ulcerated crater surrounded by dilated telangiectatic vesicle. Pink pearl-like papule. Classic location is the upper lip. Histology shows nodules of basal cells with peripheral palisading. Treatment is surgical excision. Metastasis is rare. As you can see, basal cell carcinoma in figure 19.10. The clinical appearance and in B microscopic appearance. Number 4. Squamous cell carcinoma. Malignant proliferation of squamous cells characterized by formation of keratin pearls. These factors stem from UVB-induced DNA damage and include prolonged exposure to sunlight, albinism, and xeroderma pigmentosum. Additional risk factors include immunosuppressive therapy, arsenic exposure, and chronic inflammation. For example, scar from burn or draining sinus tract. Presents as an ulcerated nodular mass, usually on the face, classically involving the lower lip. Treatment is excision. Metastasis is uncommon. Actinic keratosis is a precursor lesion of squamous cell carcinoma and presents as a hyperkeratotic scaly plaque often on face, back, or neck. Keratoacanthoma is well differentiated squamous cell carcinoma that develops rapidly and regresses spontaneously. Presents as a cup-shaped tumor filled with keratin debris. Disorders of pigmentation and melanocytes. The basic principles. Melanocytes are responsible for skin pigmentation and are present in the basal layer of the epidermis, derived from the neural crust. Synthesize melanin in melanosomes using tyrosine as a precursor molecule. Pass melanosomes to keratinocytes. Vitiligo. Localized loss of skin pigmentation due to autoimmune destruction of melanocytes. Number 3. Albinism. Congenital lack of pigmentation due to an enzyme defect, usually tyrosinase, that impairs melanin production. May involve the eyes, ocular form, or both the eyes and skin. Oculocutaneous form. Increased risk of squamous cell carcinoma, basal cell carcinoma, and melanoma due to reduced protection against UVB. Number 4. Freckle. Small, tan to brown macule darkens when exposed to sunlight. Due to increased number of melanosomes, melanocytes are not increased. Number 5. Melasma. Mask-like hyperpigmentation of the cheeks associated with pregnancy and oral contraceptives. Number 6. Nevus mole. Benign neoplasm of melanocytes. Congenital nevus is present at birth, often associated with hair. Acquired nevus arises later in life. Begin as nest of melanocytes at the dermal-epidermal junction. Junctional nevus, most common mole in children. Grows by extension into the dermis. Compound nevus. Junctional component is eventually lost, resulting in an intradermal nevus, which is the most common mole in adults. Characterized by a flat macule or raised papule with symmetry, sharp borders, evenly distributed color, and small diameter, less than 6 mm. Dysplasia may arise, dysplastic nevus, which is a precursor to melanoma. As you can see, congenital nevus in figure 19.12 and 19.13 shows melanoma. Melanoma is malignant neoplasm of melanocytes, most common cause of death from skin cancer. Risk factors are based on UVB-induced DNA damage and include prolonged exposure to sunlight, albinism, and xeroderma pigmentosum, an additional risk factor by dysplastic nevus syndrome, autosomal dominant disorder characterized by formation of dysplastic nevus that may progress to melanoma, presents as a mole-like growth with ABCD. Asymmetry. Borders are irregular, color is not uniform, diameter is more than 6 mm. Characterized by two growth phases, radial growth horizontally along the epidermis and superficial dermis, low risk of metastasis. Vertical growth into the deep dermis, increased risk of metastasis, depth of extension. Breast thickness is the most important prognostic factor in predicting metastasis. Variants include superficial spreading, most common subtype, dominant early radial growth results in good prognosis. Lentigo maligna melanoma. Lentiginous proliferation, radial growth, good prognosis. Nodular early vertical growth, poor prognosis. Acral lentiginous arises on the palms or soles, often in dark-skinned individuals, not related to UV light exposure.